Hi, my name is Briana, and today I'm going to show you how to do the humidity competency. So before beginning, you want to confirm the order and what FiO2 the patient needs to be on. Next, you want to see if the patient meets the indications. So indications for humidity would be that the upper airway is being bypassed, and therefore they're not getting that heat and moisture exchange. Another indication would be that the patient has thick secretions or they have upper airway edema. Some contraindications for humidity would be that the patient has hyperresponsiveness in the airway, and therefore the patient can get bronchospasms. Next, I want to check the medical chart, and I'm looking at the patient's chief complaint, their medical history, the medications they're using, their vital trends, what type of oxygen device they're on, and how long they've been on that particular device, and what kind of secretions they have, or if they have any. Next, I want to gather my equipment, so I'm going to need corrugating tubing. I'm going to need a water trap, a large volume nebulizer, and an aerosol face mask. So next I'm going to prepare to enter my patient's room. So knock knock. Yes. Hi, Mrs. Islas. My name is Briana. I'm a student with the respiratory department. And before beginning, can I please get your first, last name, and your date of birth?
Sure, it's Mickey Islas, 92782.
Okay, thank you so much. And can I see your wristband, please?
Sure.
Okay, great. Thank you so much. So what I'm going to be doing today is adding some humidity to your oxygen. I understand you have a little bit of swelling, and there's some secretions that need to be loosened. That way you can cough them out.
Okay.
And some complications that could arise with humidification would be that the tubing could get bacteria in there, therefore get contaminated, or there's a chance for overhydration, but I don't anticipate any complications, and we're going to do our best to avoid those.
Yeah.
It should make you feel a lot more relaxed and improve your work of breathing.
Okay.
Okay. And do you have any questions at this point?
No.
Okay, and you understand the procedure?
Yes, I
Okay,
do.
great.
Thank you.
Thank you. I'm also going to be getting a set of vitals, so I'm pretty sure you've had these done. I'm just going to ask that you come to the edge of the bed, and are you able to do that?
Yes.
Yeah, okay. Do you need any help doing that at this time?
No, I think I could do
You're
that.
good? Okay,
Yes, thank
perfect. And the bed's at a good height for you? Okay. So I'm going to go ahead and get some gloves on, okay?
you. Okay.
So, how are you feeling today?
I'm hoping to feel better after this treatment.
Yeah, it really should, and we want to do our best to get you feeling better and get you going home. So first I'm going to get your saturation. So I'm just going to be checking the blood, how much oxygen is in your blood. Okay, and your pulse is correlating with the pulse ox, so that's very good. And next I'm going to be checking your heart rate. Okay, you can go ahead and relax your hands. So your heart rate and your respiratory rate are within normal limits, and I'm looking at you and you have no sign of respiratory distress, no accessory muscle use, or any cyanosis, so that's very good. Okay, next I'm going to be checking your breath sounds. So I'm going to start from the back, and then I'm going to start at the bottom of your back and work my way up. I'm also going to be listening to your neck and a little bit of your chest area.
Okay.
So I'm going to go ahead and get that ready. So when I place my stethoscope on your back, I want you to take a nice deep breath, okay?
Okay.
Take a deep breath in. Okay, next I'm going to ask you have your arms to the side a little bit. Thank you very much for being so cooperative. And if you like, you can go ahead and get back in bed and get nice and comfortable.
Thank you.
You're welcome. Okay, so let me help you with that.
Oh, thank you, Briana.
So I'm going to go ahead and get ready to go ahead and put everything together. So just take me a minute.
Okay.
So first I want to get my equipment ready, and I will gather my tubing. You don't want the equipment to touch the floor because there's a chance for contamination. So by any chance that it does fall, all you have to do is just grab a clean one and go back into assembling your equipment. So I'm going to put it according to the doctor's orders. So he wanted it at 28%, so that would be at 5 liters. Okay, and there's also a little chart here that you can look at if you ever need to refer to it. Okay, and it's at 28%. Okay, great. Go. Just making sure it's tight enough. Okay. Next we can get the water trap ready. Okay, and you want the water trap to be at the bottom of the bed, that way the condensation could collect into this bag. If the patient's on humidity for a while, you want to change out these bags periodically if they're full. Okay, so I want to be very careful. And actually I want to attach the bag first, that way. Okay, now it's ready. And I'm going to go ahead and attach it here. So now it is attached, so I can pull on it and it's not going to fall. And next I could attach this tube. And there we go. So I could turn on my oxygen source. And I want it to be at 5 liters a minute. Again, because that's the physician's order. And I want to check to see if there's adequate humidity coming out. So I could just hold it against my skin and I could feel that humidity coming out before I put it on the patient. So now that I confirm there's adequate humidity, I could attach it to the mask. Alright, Mrs. Islos, I'm going to go ahead and put on your mask now.
Okay.
And again, this should have you feeling a lot better. I'm going to put it on, just ask you to raise your head. Thank you so much. How does that feel?
Oh, that's
It's
good.
not in your eye or irritating your ear or anything?
No.
It's good? Okay. Let me get some of this tubing out of your way. Okay, so it should take a couple minutes, maybe around 15, to really feel the effect. You know, it should release some of that swelling again, and maybe you might start coughing up a little bit.
Okay.
Secretions. I'm going to give you this little napkin in case you have to. And then
Thank you, Briana.
you're welcome. You could just remove the mask and spit into there if you need it. And I really want to pay attention to the type of secretions that come out. I want to pay attention to the amount, the consistency, the odor. It can help me to further assess what the patient needs. Okay, so about 15 minutes, I'm going to go ahead and take your vitals now. Okay, and I'm going to put this back on your finger. Do you feel a little better now with that? Okay, that's very good. Alright. I'm going to check your heart rate. You can go ahead and relax your hand. Next, I want to listen to her upper airway. Make sure that there's no stridor or anything. And, Mrs. Islas, I'm just gonna listen to the upper airway. I'm gonna zap your gown and I'll put it right back.
Okay.
Thank you. Okay. Can I ask you to maybe lift up just a little bit? Okay.
Is this okay?
You can go ahead and relax. Okay, so everything sounds really good. It sounds better than it did earlier. And the breath sounds nice and clear. So, do you have any questions before I go?
No, Brianna.
Do you need anything? Can I get you an extra pillow, water?
I'm okay right
You're
now.
good?
Yes,
Okay.
thank you.
Alright, I'm gonna leave your call button right here next to you. And again, my name is Briana, so feel free to call me and let me know whatever you need, okay? I'll be happy to help you. Thank you so much for being so cooperative. It was nice to meet you.
Thank you, Brianna.
Okay, thank you. I'm gonna go ahead and dispose of my gloves and wash my hands. So I'm leaving the patient's room. I want to go ahead and document. So I'm documenting their pre and their post vitals. I'm documenting how she tolerated the humidity in her oxygen device and what type of liters per minute she was on and the percentage that was on the large volume nebulizer. I also want to document any adverse effects that could have happened, or may have happened. So thank you very much for watching. Bye-bye.